Good afternoon, everyone. On behalf of agricultureinformation.com, I'd like to invite the speaker, Mr. Mithun G, who will speak about what is occupational zoonotic diseases. I now request the speaker to begin. Thank you.
Hello everyone, myself
Yes.
Mithun.
Please go ahead.
Hello everyone, myself Mithun G, and I'm working as a subject matter specialist at DDS Krishi Vigyan Kendra, Sangareddy district, Zahirabad, Telangana. So actually, at the beginning of my session itself, I would like to thank Agriculture Information for the opportunity and for letting me here. So actually, I'm here to discuss or to share a few points about one particular kind of diseases called zoonotic diseases. In precisely, we talk about occupational zoonotic diseases. So let me explain what are zoonotic diseases. So zoonotic diseases, these are the diseases which transmit from animals to humans as well as from humans to animals. So which can be transmittable in both the ways, either from animals to humans or from humans to animals. So those are called zoonotic diseases. And coming with the term occupational zoonotic diseases, these are the diseases which can be transmitted from animals to humans as well as from humans to animals through occupation. Like, say for example, here we consider one individual or one human being who is working as an agricultural labor, and at the same time we'll consider another individual who is working as an veterinarian. I mean to say a veterinary doctor. So here we are comparing two individuals with two different occupations. One is working as an agricultural labor and the second one is working as a veterinary doctor. So in both the cases, their occupations are different. And at the same time, the kind of zoonotic diseases that they encounter in their occupation also varies. What I want to explain, these are the zoonotic diseases that acquires to the individual through their occupation. So it differs from individual to individual, and depending this is how the term occupational zoonotic diseases sounds. And now coming with the further presentations, actually, as I explained earlier, these zoonotic diseases, they differ from individual to individual depending upon their occupation. Some individual they work as an agricultural labor, some individual work as a veterinary doctor, some individuals work as a farm laborers, some individual work in the fields, some individual works in factories. So the kind of occupational zoonotic diseases that one individual encounters varies. And although the risk of the exposure to zoonosis is equal to all the members of the society, but certain occupational groups are especially at the risk, like as I explained earlier, like the dairy farmers or sheep and goat farmers. So these are and as well as the veterinary doctors or any agricultural laborers or animal handlers. So these are certain groups of the people who are especially at the risk. So that's what I would like to explain. And coming with the further sessions, that is as we explained about.
Yeah, as you speak, please change the slides.
Definitely, madam.
Yeah.
I'm initially telling about the introduction, madam.
Okay.
So just explaining about what are occupational diseases and what are occupational zoonotic diseases, like that.
Yeah, can you just zoom little or change the direction of the mobile? The text content is, yeah, now fine. Please go ahead.
Okay. So in the earlier slide, I explained about the zoonotic diseases and the entire term occupational zoonotic diseases. Now I would like to go through with the classification of occupational zoonotic diseases. As I explained earlier, the individuals indulge in various occupations. So the kind of zoonotic diseases that they encounter in their occupation also varies. Say for example, if you consider the agricultural sector, here the kind of persons who are employed varies, like the agricultural farmers or the agricultural laborers or the veterinarians who are involved in treating the animals that are used in agriculture. Say, for example, the animals are, the bulls, or particularly the bulls, are used for drought purposes. So, for treating those animals, a veterinarian is required, like the same way with the livestock inspectors and the persons who are involved in transporting the agricultural products. So, those are the transporters of livestock and various other persons who come in contact with animals, either at their farm or at their home, at any place it may be. The persons who are more closely associated with animals, they encounter these kind of occupational zoonotic diseases like anthrax, brucellosis, tuberculosis. We'll talk about these the details of these particular diseases briefly in the further slides. With the second classification, there comes the animal handlers. So under this particular section, the people of butchers, slaughtermen, the people who are involved in slaughterhouses, where the sheep and goat or cattle or buffalo, where they are slaughtered. So those slaughtermen who are involved particularly in the slaughterhouses, and the meat inspectors who are involved in inspecting the slaughtered meat in the slaughterhouses, as well as other slaughterhouse personals, like the persons who are involved in cleaning of these slaughterhouses, and the persons who are working in cold storages, like the slaughtered meat, because in the slaughterhouses, per day itself, nearly 100 to 200 kilos, depending upon the size of the slaughterhouse, or depending upon the number of animals that a slaughterhouse can accommodate. So the amount of meat getting from that particular slaughterhouse per day varies. So they definitely need cold storages in order to store, or in order to increase the shelf life of the meat. So the persons who are involved in cold storages, that means those persons are coming close contact with the meat. They just get the meat and keep those meat pieces in the cold storages or in the boxes. And the people or the men who are involved in food processing plants. So all these people who come in contact with animals, directly with the animals or indirectly also, they encounter the diseases like FMD, which means foot and mouth disease, followed by anthrax, rabies, brucellosis, tetanus, etc. And with the further classification, recreation. Being humans, we are all associated with animals, in precisely to say domestic animals. Particularly pets, for recreation purpose, we keep the people who reside in cities or towns, they majorly take care of the pets, which includes either it can be dogs, or it can be birds, or it can be cats, any other pet animals they generally use for their recreation purpose, or for their happiness, or for in terms of their desire, they raise those animals. So even while handling those animals, also the people who are handling the animals, they may get these kind of diseases like psittacosis, toxoplasmosis, campylobacteriosis, etc. And in emergency situations like floods, or in case of any disasters, any natural disasters, or any victims of those those natural disasters, those people might they have a chance of getting this particular disease called a plague, or in precisely to say, the people who are who experience this natural disaster called earthquakes, volcanoes. So the people who are in and around these particular natural disasters, or who are experiencing or who experienced these kind of disasters, in those places, there will be high chances of this particular disease called a plague. So now we talk about, I just enlisted all the diseases which are common to the people who are involved in or indulged in various occupations. Now we'll go in brief manner regarding those diseases, and finally, I would conclude the session with another topic called a lumpy skin disease, which is a havoc in India today, especially for the dairy farmers, as they are encountering huge economic losses with this particular disease called lumpy skin disease. So I would like to conclude that session, but it's not a zoonotic disease, but I would like to conclude the session with that particular disease, as the farmers today at present are encountering that particular severity, or they are encountering the severity of that particular disease. Okay, firstly, I'd like to explain anthrax. In the diseases, whether it can be a zoonotic disease or it can be the diseases which are most prevalent. So any disease in various types, like depending upon the causative organism, that means which is causing that particular disease. So depending upon the organism, the diseases are classified into various types. Like if the disease causing organism is a bacteria, it's called a bacterial disease. If the disease causing organism is a virus, it's called viral disease. If it is a fungi, it's called fungal disease. If it's a parasite, it can be called as a parasitic disease. So this particular anthrax that we spoke about earlier, so anthrax is a bacterial disease, and it is caused by Bacillus anthracis. It's a bacterial microorganism called Bacillus anthracis. So that particular organism is causing this anthrax. What are the symptoms that one has to see, or one has to find out whether he or that particular animal that he is raising is having this particular anthrax? This particular anthrax disease is most common in domestic animals, in precisely to say cloven-footed animals, which means the cattle and buffalo. Particularly in 90% of the cases, the anthrax is seen in these particular cloven-footed animals, and in rare conditions, this can be seen in case of sheep and goat also, and in humans as well. As this particular anthrax can spread from animals to humans as well as from humans to animals. Firstly, I would like to mention the symptoms that one has to identify in case of anthrax. So the one and only symptom that one can find in the dairy animals or the other cloven-footed animals is swelling of the lymph nodes. I can show you another presentation. So here, if you can see at this below the line, this particular buffalo is having a swollen lymph node condition. So those are called, that is the place where this particular part or organ called lymph node is present, just below the jawline. You can I have zoomed the image. You can definitely see this near to the ear lobe of that particular buffalo, where the swelling of the jawline you can see, that place where the lymph node is present. So swelling of the lymph node is one such condition of particular this is called anthrax. So other than this, other common signs that that is present in any kind of bacterial disease, which is a slight increase in the temperature, which may result in fever, as well as decreased intake of feed, as well as decreased intake of fodder. This can be seen, but precisely only one clinical sign, that is swelling of the lymph nodes. Apart from this, there is a one particular major sign or symptom that one can encounter in the animals, that is a bleeding from the natural orifices, from all the natural orifices. That means from all the natural openings of the animal, like through the ears, through the mouth, through the nose, through the anus. If there is a cow, through the vagina also. So from all these natural orifices, there is a oozing of blood, just like a water. It just oozes from all of these natural orifices all of a sudden. So this is one critical sign indicating that the animal is having anthrax, and moreover, you can't save the animal if the animal shows this particular sign, because the animal will eventually die in a span of hours itself. So this is the sign. If you fail to recognize one particular sign that I explained earlier, that is swelling of the lymph nodes. If you fail to recognize that particular sign, then you will eventually end up with this particular major clinical sign that is called oozing of the blood. That is in precisely to say black colored blood. Oozing of this particular black colored blood from the natural orifices of the animals. That is the major sign. And if the animal shows this particular symptom, then that will definitely die in hours, within hours. You can't even treat the animal. And moreover, you should not touch the animal because as I explained earlier, anthrax is caused by bacillus anthracis. This particular bacteria is present in each and every part of that particular animal, and it's just like a corona. If any particular thing, either it can be blood, either it can be urine, or either it can be the feces or dung, whatever the thing it may be, if anything that is related to animal, if it come in contact with the humans, then that particular human being also will get the same anthrax disease. But the clinical signs may vary in the humans. Like in the human beings, they'll encounter the disorders or any diseases related to the skin, in precisely on the hands itself. In between the, below the elbow, they'll have this kind of skin lesions. The person who is having who come in contact with this particular anthrax affected animal, they'll have this kind of skin lesions in precisely below the elbow region. So if one individual finds any kind of skin lesions on the above the neck or around, in and around the neck and on the thighs, and in particularly below the elbow region on the hands, then he should check for the anthrax. But it can be as the vaccines are available for these particular diseases, in case of animals or in case of humans, so no need to get worried. But the people who are indulged in these kind of activities, like farming activities or veterinarians who animals, they might not know if the owner of this particular animal, if he doesn't know anything about the anthrax, then even though if the animal is affected with anthrax, they are not in a situation or in a position to explain the current situation of the animal to the veterinarian. So the veterinarian who indulged in treating that particular animal, he's also having high chances of getting this particular anthrax. So as I have explained just now, you have to take care of these particular clinical signs like swelling of the lymph nodes in case of animals, and oozing of blood from the natural orifices. This is not a sign, but it's a final, just like a final stage. So the only symptom that you have to observe is this particular swelling of lymph nodes, and in case of human beings, it's a skin lesions at anywhere, but in precisely below the elbow region. Coming with the other disease, that is brucellosis. So brucellosis is, if you want any kind of comparison, it's like a disease which mainly focuses on the reproductive system of the persons who came in contact with this particular brucellosis organism. Actually, brucellosis disease is caused by a bacteria, Brucella bacteria. So if this particular Brucella bacteria, if it come in contact with any kind of human beings, in particularly males, it shows a minimal effect in case of females, but it affects majorly in case of males, as this particular microorganism, like the same way, the persons or the individuals who come in close contact with the animals, if the animal is having any kind of any brucellosis, then if the persons who come in close contact with these animals, in particularly to say, when the person come in contact with the vaginal discharges, obviously the farmers who are farmers or agricultural laborers or any kind of animal handlers who are in and around the animals, if they are involved in the animal maintaining activities, they have to observe these vaginal discharges, because at the time itself they can go for insemination, so that the animal become pregnant and deliver another calf. So they should definitely observe this particular vaginal discharges or nasal discharges or ocular discharges. That means the discharges through the eyes. And if they come in contact with the parts like a mouth and a muzzle means not the body muscle. Its muzzle is a part just above the lip, in between the nostrils in the animal. So that we call as muzzle, muzzle. So when the person come in contact with this muzzle part, or the mouth part, or nose part, or eyes, where the discharges occur along with these vaginal discharges, they have high chances of getting this particular disease called brucellosis. So what can be the symptoms? Here is the ultimate negative effect of this particular brucellosis disease in case of humans is they fail to reproduce. Why means this particular brucellosis organism, they directly target the reproductive system. They just enter into the body, directly find their way to the reproductive system, in precisely the male reproductive system, where they affect the gonads, so that initially in the spermatic fluid, the number of sperms which are required in order to get fertilized with the ova, so those many sperms will not get produced, because this particular brucellosis organism, as they are residing in the reproductive organs, in precisely to say the gonads, they kill the sperms in the spermatic fluid. So the individual fails to reproduce. He can't have kids, and moreover, what is the another clinical sign in some individuals, depending upon the genetics, but in every human being, and in every human being, like I'm talking about the males, they'll have this particular reproductive disorders, like I said earlier, shortage of sperms. And in some people, we can see another signs, those also related to the reproductive organs only. That is nothing but enlargement of scrotum. So the scrotum enlarges to such an extent, like from 1 to 30 centimeters. It is that particular scenario is it's such a condition, like the individual, even he feels very pain, even if he is wearing a pant also. So to that extent, the scrotum will get enlarged. So that's also a sign, which it can be mostly seen in the case of African people who are near to the forest. In those people, this particular sign is mostly it's appearing. But in all the people who are affected with this particular brucellosis, they encounter the other reproductive disorders, like I said earlier. And coming with other condition called bovine tuberculosis. In shortly to say TB, as we are human beings, we all know that TB, Mycobacterium tuberculosis, is the Mycobacterium tuberculosis is the causative organism, and tuberculosis, in shortly to say TB, we can see this commonly in case of humans. Even that disease also comes as a zoonotic disease from bovines. That means from cattle and buffalo. Here also the same thing. If the animal is having tuberculosis or TB, if the individual comes in contact with the sputum, or with any kind of nasal discharges, or with any kind of oral discharges, or if any kind of discharges related to eye, that is ocular discharges, then that particular person who came in contact with these particular discharges may have high chances of getting the tuberculosis from the animals, not from other human beings. I'm talking about animals, as we are explaining about the zoonotic diseases. So those individuals are also having the high chances of acquiring the tuberculosis. And the symptoms in these particular zoonotic disease, as well as in the tuberculosis that is spreading in between the human beings, the symptoms are same in both the conditions. Like this particular Mycobacterium tuberculosis, or this particular disease, precisely affect respiratory organs. So one finds difficulty in breathing, and their lungs will get extremely affected in the later stages. And these particular Mycobacterium tuberculosis, the causative organism, it will be present in the sputum of the animal. Each and every time the individual has to spit. So in that particular sputum, we call it as sputum in our language. So in that particular spit or sputum, this particular Mycobacterium tuberculosis causative organism is present, and it will spread from humans to again humans, or humans from this particular sputum to any kind of animals who come in contact with that particular sputum. So any kind of respiratory disorders that it can be a cough, it can be a cold, or it can be difficulty in case of breathing. So any other disorder related to lungs or related to the respiratory system that is done by the Mycobacterium tuberculosis, which ultimately causes the tuberculosis in case of human beings. And coming with the animal handlers, where they might be getting this FMD. FMD is nothing but a foot and mouth disease. This particular disease it is most common in case of this particular cloven-footed animals. That means to say the cattle and buffalo, and also sheep and goat also. So in these particular animals, either it can be in cattle or buffalo or sheep or goat, the symptoms or the clinical signs that they express or they produce is quite the same. As the name itself suggests, it is foot and mouth disease. Here, this is a viral disease. Up to now, we just spoke about the bacterial diseases, but this particular FMD disease is a viral disease. So in this particular viral disease, the animal is exhibiting the clinical signs like oral lesions. As it is a foot and mouth disease, the lesions will be in the mouth or inside the lips or around the gums, as well as on the tongue, on the upper side as well as on the lower side of the tongue, and hard palate. The part that is present just above the tongue, that is called hard palate. So the hard palate. So in and around the mouth, the oral lesions will be found. So this is the lesions at the mouth region. If the same lesions, if we found at the foot region, just above the hoof and also around the hoof, above the hoof and around the hoof, if the clinic or lesions are found in that particular foot region, then those are called the foot lesions. Apart from this, as it is a viral disease, the animal will definitely have the bacteria. I mean, as a bacterial overload is present in that particular animal, so there is a slight change in the temperature, which ultimately resulted in a fever condition, followed by a drop in intake of feed and fodder, followed by decreased water intake also. These kind of symptoms like change in the temperature or fever condition or decrease in the feed intake or water intake, along with these oral lesions and foot lesions, then we can sense it as an FMD affected animal. So if not in all the people, but among 100 people, maybe 20 to 23 people might get affected with this particular FMD disease. I mean, the persons who come in contact with this FMD affected animal, then they'll definitely have high chances of getting this particular disease. The clinical signs will be the same in case of humans also. Like there are lesions on the mouth or oral region, like either on the tongue or below the tongue or above the tongue, on the hard palate or on the gums or inside the lip or around the mouth, the same oral lesions. But these lesions at the foot will not be found in case of humans, but the oral lesions can be found. Along with these oral lesions, there will be the change in the temperature of that animal, in particularly to say within a span of 2 to 3 days, the human being will show the signs of fever, like a cough, cold, and he also decreases his regular feed intake. So if one individual is showing these kind of signs along with the oral lesions, then we can sense along with, I mean, when we compare with the occupation of the animal, we could sense it as an FMD. Say, for example, if these kind of signs are seen in meat inspectors or slaughtermen or the people who are involved in cleaning of those slaughterhouses or butchermen who are present in the slaughter shops. So if they are showing these kind of symptoms, then we could sense it as an FMD. And anthrax we already discussed, and brucellosis also we discussed, and rabies. Rabies is also one such disease, as we all know, because rabies is generally comes from dog bite, in some situations from cat bite. In some scenarios, in human beings may have this particular rabies condition through bat bite also. So mainly we encounter this disease through dog bite, in some conditions through cat bite. So what happens here? What kind of signs this particular rabies disease shows in the humans? Firstly, we talk about the clinical signs or the symptoms that a dog or a cat shows, followed by the clinical signs of the symptoms that a human being can show. So, firstly, a rabid dog, that means a dog which is affected with rabies disease. A rabid dog, it shows the clinical signs like that particular dog, he or she is afraid of water, like a phobia, just like a phobia of to water. That this particular water phobia will get developed in that particular dog, and moreover, the dog will become, or the dog or cat, it becomes so aggressive that it always barks even at the owner also, who is closely associated with that particular animal. Even at that person also, it aggressively barks, and not only at times, but almost all the time. Even the condition progresses, almost at all the time. Animals, either it can be dog or cat, it barks. And moreover, as it's a viral disease, rabies is a viral disease. We can also see the symptoms like change in the temperature, which may eventually lead to fever, followed by decreased feed and water intake, and water phobia, followed by temporal twitching, which means if we keep our hand in the region on the head, in between the two earlobes of the dog or on the cat, in between the two earlobes, the area that is above the upper side of the head, in between the two earlobes, if we keep our hand in that particular region, we can experience this particular thing called temporal twitching, where we can, like a pulse rate, the same kind of like how a pulse we experience at the hand, like the same way we experience this temporal twitching, same pulsating sound. So that can be seen in case of a rabid dog. These are the symptoms that generally we see in case of a rabid dog. Followed by here, the persons who come in contact with the rabid dog secretions, like it can be the nasal secretions or oral secretions, it can be a saliva or anything. The persons or the individuals who come in contact with this particular rabid dog secretions, they have high chances, or they're more prone for this particular rabies. So the rabies, this particular disease, either in case of dogs or when it's spread to humans also, that their main target system is a nervous system. So a rabid dog or a rabid dog bitten person, no signs. Like for example, they'll be normal, but at times they used to there is a change in their gait, or in simpler terms to say, there's a change in their walk, or the way how an individual walks, and all of a sudden he'll shows seizures. That means, in simpler terms to say, we call it as fits in some local language. So generally we call it as seizures. So seizures can be seen, and other nervous disorders where the individual brain cells will get damaged. What we call as neurons, it will get damaged just because of this viral organism inside. So he'll just behave like a madman. So those are the kind of symptoms that a rabid person may encounter. But even though if a rabid dog bites a person, or if a person come in contact with these secretions of a rabid dog, but there is no guarantee that the person has to immediately express his symptoms or clinical signs. The time varies from individual to individual, or varies from genetics. It all depends upon genetics. Say for example, there is a case where a woman is bitten by a rabid dog, and she expressed the symptoms of rabies after 11 years. Even the dog, after the dog bite, after 11 years, she expressed her signs of rabies. So the time of expressing these particular clinical signs or the symptoms may vary from individual to individual. It all depends upon the genetics. So this is about the rabies and the clinical signs in case of dogs or cats, and in case of human beings too. Followed by the thing that is called tetanus. Tetanus, it's a disease particularly caused by a bacteria called Clostridium tetani. So this particular tetanus condition, it's also called as lock jaw condition. It also spreads from animals to humans as well as from humans to animals. This particular microorganism, that is bacteria, Clostridium tetani. The target system of this particular bacteria is a muscular system. So we call it as spasms. Like it's also just like a seizures, but at the muscular region, not on the entire body part, but at the muscular region. So muscular spasms and muscular paralysis, a paralytic condition can also be seen in this particular disease. The same signs can be seen both in case of animals, either it can be cattle or buffalo, or it can be a human being. The same kind of signs you can see. So muscular system will get damaged. He or she may have a paralysis condition of either it can be leg or hand or any other part. There is a paralysis condition and lockjaw condition. In this condition, our jaw, either it can be on left side part of the jaw or on the right side part of the jaw. This particular jaw will get stuck just because of this particular organisms overload in this particular area. The jaw will get locked in such a position that you can't even move it. So along with these muscular spasms or any kind of paralytic conditions, you can also encounter this particular condition called a lockjaw. And it's also, this particular tetanus is very dangerous in case of in humans too, as it makes the human beings to completely burden to even also in certain scenarios. So one has to look after this particular tetanus condition if he or she is involved in handling of dairy animals in precisely. And we'll go with other diseases like toxoplasmosis, psittacosis, campylobacteriosis. This particular diseases, this can't be seen in all the animals, all the human beings, but the people who are majorly involved in rearing of or raising of pet birds, they encounter this disease called psittacosis. In precisely, if they are into raising the parrots or sparrows, so those people they are more prone for this particular disease called psittacosis. And the people or the women in particularly, the women who are interested or who are already raising the cats, they are more prone for getting this particular disease called toxoplasmosis. What this toxoplasmosis do is, it particularly targets the reproductive system of females. Earlier we discussed brucellosis, where that particular microorganism or the bacteria, so that particular bacteria targets the reproductive system of males. Here toxoplasmosis targets the reproductive system of females more likely. So what happens in toxoplasmosis is the ova, whatever the ova that is producing by the ovary, so that particular ova will get destroyed, or there is a malfunction in producing the ova by the ovary. So if a woman fails to produce ova as a part of her menstrual cycle, then she is not able to give birth. So this particular reproductive disorder you can see in the women who are more likely into rearing of cats, not dogs. The women who are raising the dogs, they have less chances of getting this particular disease. But the people, I mean, in precisely the women who are more indulgent in raising the cats, they are more likely to get this particular disease called toxoplasmosis. As I said earlier, the psittacosis along with the campylobacteriosis also, this particular disease you can see in those men or women who are into raising of the pet birds, precisely the parrots, sparrows, or some they call it as a lovebirds also. So in those pet birds, through those pet birds, they'll get these chances of disease called psittacosis and campylobacteriosis. But we discussed the clinical signs of toxoplasmosis, that is any disorder that is related to the reproductive system of the women's. Either it can be in disorder in their menstrual cycle, or a disorder, either it can be excessive bleeding during their menstrual cycle, or whether if they fail to reproduce, or miscarriage. Sometimes the women are able to conceive, but within 4 to 5 months it will get miscarried. So, but also just because of this particular toxoplasmosis or toxoplasma bacteria. So if this particular microorganism, if it resides in the reproductive system of the females, then they'll have high chances of this abortions or miscarriage, what we call. And moreover, the chances of getting pregnant will get almost to zero. So the particular serious is this issue. But that's not the case with psittacosis or campylobacteriosis. We can treat those diseases, but particular brucellosis as well as the toxoplasmosis. And finally, with the emergency situation that is called plague disease, which we see in the emergency situations during the natural disasters. It can be floods or cyclones or earthquakes, volcanoes. So whatever the spoken natural disasters, in those conditions, there are high chances of erupting of this particular disease called or rats. As we all know, this particular plague, many of the people died in the history earlier, and we all know it's a part of history. So plague is such a dangerous disease. It spreads from humans to humans as well as humans to animals. So it's a zoonotic. It's also considered a zoonotic disease, and rats, they are the carriers of this particular disease spoken earlier. But we go or we discuss less about the plague, because it's not just like it almost an extincted disease. We don't find any kind of plague cases in and around nowadays. I hope you are well aware of, you became well aware of this particular diseases called anthrax, brucellosis, tuberculosis, FMD, rabies, tetanus, toxoplasmosis, and finally a little about psittacosis, campylobacteriosis. Hello.
Yes, Mr. Mithun, you have completed? Hello.
Not yet, madam. If you want,
actually we are running short
hello,
of
madam.
time. Yeah, we are running short of time.
Okay, madam.
How many slides are left?
Pertaining to this particular title, it's almost done, madam.
Okay, you complete.
Actually, the content regarding this particular title is it was already completed, madam, just now. But I want to conclude the session with one last disease called lumpy skin disease, which is most prevalent nowadays in dairy animals. If you
go ahead.
like to, thank you, madam. So I would like to conclude the session with one particular disease called lumpy skin disease, which is creating a havoc nowadays, because the dairy farmer is affecting so bad economically. He's getting affected so bad economically. In numbers to say, if I'm not wrong, nearly 1,12,000 to 1,40,000 animals, dairy animals, they got died in this particular year itself, from February to till date. Dairy animals, and the vaccine against this particular disease, it is also not working. But we are trying to give vaccine called goatpoxin, which is scientists are expecting that it could at least control this particular disease. Called lumpy skin disease. I'll go briefly about this. In this particular lumpy skin disease, it spreads from animals to animals, particularly dairy animals only, not to humans. So a farmer can, without any second thought, he can involve in the treatment aspects, because there is zero chances of getting this particular disease from animals to humans. So this particular lumpy skin disease, here what are the clinical signs that the dairy animal is expressing is lumps. That means nodules all over the body, wherever the skin is present, just in the area above the eyelashes to the area present in and around the tail. So from that region to this region, wherever the skin is present, in all those, these particular lumps or nodules nodular structures will get erupted, and these nodules vary in size from 2 to 5 centimeters, and these nodules will extend to such an area like from topical part of the skin to even the deeper parts of the muscles also. It extends to such an extent. So, and this particular nodules eventually after if the disease progresses for a week, this nodule will get broken, and the inner parts of the like the topical skin it will get broken, and it will expose the inner muscular part, and also the nodule starts bleeding. So as the nodules are present all over the surface of the body of the animal, you can see the bleeding from almost each and every nodule if the disease progresses. So along with this particular nodular condition, the animal will stop or it decreases its feed intake followed by water intake, as well as this change in the temperature of the body of the animal, which eventually led to the fever also. So the treatment aspects to this particular disease is also present, but what happens here is the veterinary doctor or the regional veterinary handler, he has to treat the animal till all the symptoms get started. So it would take nearly 15 to 20, sometimes it may go up to 40 days also. So each and every day the treatment costs from 500 to 600 per day. So the kind of economic loss that a farmer can encounter once the animal get affected with this particular disease is very huge. Even if the animal gets affected with this particular disease, the farmer, he is not able to sell the animal, or he is not able to leave the animal also, because if he sells the animal or if he moves the animal also from his place to any other place, he'll be charged. So he can be put into jail. So those are the latest criteria on this particular disease. So here the treatment aspect lies in our way old Ayurveda. So some of the Ayurvedic practices are more effective in treating this particular disease. I can provide you a few, like while the animal handler or the dairy farmer who is involved in cleaning the animal, so he should clean the animal not with cool but the lukewarm water, in which the neem leaves as well as turmeric powder along with the shikakai powder. He has to put a handful of shikakai powder and a handful of turmeric powder and 2 to 3 handfuls of these neem leaves into the water, and he has to boil it for 15 minutes to 20 minutes, and he has to cool it down, like he has to bring it down to a lukewarm state, and he has to mix thoroughly, and he has to use that particular water to clean the animal, and will get subsided eventually within 30 days. And betel leaves, in some local language they call it as tamalapaku, but in my regional language they call it as tamalapaku, but in English they can call it as betel leaves. So 10 betel leaves and nearly 10 grams of pepper, black pepper, and along with a spoon of powder, 2 spoonful of jaggery, a spoonful of turmeric powder, 10 grams of black pepper, 10 betel leaves, and 2 spoonfuls of jaggery powder. You have to mix this into a paste, and you have to feed this animal daily thrice until the condition subsides. The animal will definitely shows decrease in the clinical signs of this particular disease. So by providing this information, I'd like to conclude the session, and I also want to thank the agricultural information for providing me this opportunity, and thank you everyone too.
Thank you, Mr. Mithun, for the detailed presentation. Now we'll take some questions. In the meantime, can you please stop sharing the screen and on your camera so that it will be more interactive.
Okay, madam.
Okay, so yeah. 1 second. Yeah, did you on the camera?
Yeah, madam, actually. But,
It's not coming. Okay. So I'll move ahead with the first question. First question is, farmers are most of the time with the animals. How can they save themselves from this disease?
farmers?
Farmers are most of the time with the animals. How
Yeah.
can they save themselves from this disease?
Just with the managemental practices itself. You can't save yourself from getting affected from these animals, but you can save the animals from getting affected from these diseases. So it all lies in the managemental practices that you or the animal handler who has to undertake the care of the animals. So firstly, the person who are involved in this in the rearing of animals, he has to wash his hands just before and after handling the animal, and he has to trim his nails, he has to cut his hair, because his even with his hair also there are chances of getting affected at the time of handling the animal. It would be better if he wears a small cap that the surgeons usually wear during the at the time of operations or any kind of surgeries. It would be better if precisely I'm giving this suggestion to the people who are involved in milking the animals. For those persons who are involved in particularly milking the animals, it would be better to wear a cap, not for all the persons. And his personal hygiene along with the management practices of the animals, like cleaning the animals, maintaining the environment in and around the environment of the animal. So with those management practices, you can easily make the animal unaffected from these kind of diseases, man.
Okay.
So if the person or the person who is associated with those animals, if they remain unaffected, and the person will eventually doesn't get affected from these kind of diseases.
Okay. Next question is, what is the cure for this disease?
And well, for each and every disease that I have spoken earlier, for every disease there is a vaccination. So one has to, it's a preventive measure. The individuals who are involved in raising the animals, they have to take this particular vaccination, and they have to offer this vaccination to animals also. So if they do both these things along with the managemental practices as well as other personal hygiene practices, they can the chances of getting affected is very meager. Hello, madam. Hello.
Yeah. Okay. So next question is, we haven't heard anything about this disease earlier. Since how long is this in existence?
This disease means what particular disease, madam?
Zoonotic.
Okay, zoonotic diseases.
Yeah, zoonotic.
Zoonotic diseases are way earlier, but we don't know that whether one particular disease it will spread from animals to humans. We don't know that, but the persons who are well aware of these diseases are the farmers, in particularly the dairy farmers or any other livestock farmer. If he is in contact, as he's having the animals, if he is in contact with the regional or nearest veterinarian, then he'll definitely provide information about all these kind of diseases. So these zoonotic diseases are existing way back earlier itself, just like a corona, because you can't before the attack of the corona, no one knows that the corona spreads from one human to another human through these nasal discharges, or through any kind of these oral discharges, or any kind of handshaking, or any kind of contamination. So no one knows anything about the corona earlier, but once it started, everyone knows about it. Everyone starts talking about it or taking the preventive measures. So like the same way, zoonotic diseases are those if the persons are who are in close contact with the animals, they might know about these particular diseases, some at least some of the diseases, but they don't know the term zoonotic diseases. That's it. But each and everyone or every farmer will be aware of one or other disease at least.
Okay.
But they don't know the term that all these kind of diseases will come under an umbrella called zoonotic diseases.
Okay. Next question is this disease only in India or other countries as well?
Everywhere, nook and corner of the earth, everywhere you can find this kind of zoonotic diseases. In particularly rural areas, whatever the country it can be rural areas, in particularly where the animals are not maintained under hygienic conditions, or where the farms or the people where the animals are maintained under unhygienic conditions. So at those scenarios, the prevalence of these zoonotic diseases is very high. So it's everywhere.
Okay. There are two more questions, but since we are running short of time, I'll take as a last question. As a subject matter specialist at KVK, what is your exact role?
Okay. Subject matter specialist. So my role, in precisely to say, being a veterinarian, I can provide veterinary services like a veterinary doctor, but as a postgraduate and as per my job profile, I have to make the farmers aware about everything. I have to make the farmers aware of this latest havoc called lumpy skin now at this current scenario. Irrespective of this scenario, I have to make them aware of the feeding practices of the dairy animals, or of the sheep and goat, or of the poultry, whatever the animals it can be. I have to make them aware of the feeding practices, breeding practices, health practices, and managemental practices. I have to make the farmers so that I have to help the farmers in such a way that they could help themselves, and so that I have to help in such a way that they could help themselves in order to increase their farm and home income, in order to increase their economic status in the society. So I have to help them in such a way, like I have to encourage them by providing information in terms of giving them teachings, or through training programs, by conducting any awareness programs, or by conducting any kind of method demonstrations, or any kind of result demonstrations. So all these duties that I have to perform being a subject matter specialist at KVK, I have to cover the entire district is headed by me at the KVK in the veterinary sector, pertaining to veterinary sector. Like the same way my colleagues are there, and this particular district is headed by them in their sector, like in the horticulture, my colleague madam is there. In plant production, another madam is there. And in home science, like in the agronomy and extension. So there are different departments that who has to look after this entire district.
Okay. Okay, Mr. Mithun. Yeah. So now we have come to end of question round. On behalf of agricultureinformation.com, we like to thank you for a very detailed presentation and answering all the questions in very depth. And we also like to thank all the participants for joining this meeting. The meeting will now be closed.
Okay. Thank you so much.
You're most welcome. Thank you. And I have shared your contact number and email address with the participants.
Okay, ma'am.
Yeah.
That will be absolutely fine.
Yeah. Okay. Thank you.
Thank you, ma'am. Can I end the session, madam?
Yes, you can do it.
Okay. Thank you, ma'am.